Welcome to our mnemonic video on fever differential. Let's get started. This scene will take place at a running competition. The referee on the track is not looking healthy. With his sunken eyes, thermometer, and cold compress, we can clearly see that he is sick with a fever. But this veteran referee is the best in the business, so he came to the track despite his illness. Anyway, this idea here should remind you of fever, which is what this scene is all about. Every referee uses a headset, and our referee has got a special red headset. Although not common to see such a color for a referee's headset, it must be a professional brand for such events. Anyway, this headset covering the ear is red, which should make you think of inflammation and infection in the ear. Specifically, acute otitis media. Acute otitis media is a common cause of fever and will present with a bulging red tympanic membrane, much like the color of the headset. And to keep things straight and not confused with external ear infections, remember that a headset like this one is used to play media. What else could be a hurdle to this competition other than a sick referee? We can see back on the greens, a vandal is shooting a flaming arrow at the abdomen of the competitors. While the arrow was hurling toward the runner's belly, the runner attempted to block it by this pan with its oddly shaped pancreas handle. But the pan was no match for the flaming arrow, and now the flame is on his belly. Pan sounds like pancreas, emphasized by this oddly shaped pancreas handle, and the fact that it's on fire should make you think of inflammation of the pancreas, so pancreatitis. Also, this flaming arrow with an appendix-shaped end burning the belly of our runner should remind you of appendicitis. Pancreatitis and appendicitis are two of the many abdominal causes of fever. This runner wasn't so lucky, but what about his peers? Steps ahead, we see another competitor running past, clutching his head and wearing a helmet to avoid the flaming arrows. Notice that his helmet is red and covered in decorative flames. This red flaming helmet should remind you of inflammation. More specifically, inflammation of the brain or encephalitis, which is also associated with fever. Our runner is also clutching his head, which reminds us that encephalitis often presents with a severe headache. The next runner lost his helmet, and now his head is only being protected by a beanie hat. This beanie hat is covering his head closely, much like the meninges cover the brain. He's holding it so tightly that it's causing his head to turn red, with the green splotches on the beanie to remind us of an infection. More specifically, meningitis, which presents with a classic triad of fever, headache, and neck stiffness, and can proceed to an alteration in mental status, especially with bacterial meningitis. This requires proper management of shock with rapid initiation of empiric antibacterial therapy. Let's take a closer look at the greens. We can see more vandalism is taking place back there. Notice the lung-shaped tree with a saw wedged proximally to a dead branch. The vandals decided to cut down a dead branch from the lung-shaped tree to make more arrows before they run out. The lung-shaped tree with a dead branch resembles what happens to the lungs in the setting of a pulmonary embolism. The pulmonary embolism blocks the pulmonary blood flow, causing infarction distally. And this idea here should remind you of a pulmonary embolism, which can also cause a fever. To avoid the flaming arrows, this pack of athletes decides to run at full speed, kicking up dust with their shoes, causing that runner behind to cough. Running in this drama caused that guy to get sweaty as his body temperature raised like crazy. Now he has to deal with the dust as well. Anyways, this idea here of coughing, high body temperature, and sweating should remind you of pneumonia, another cause of fever. Not only did the dust cause coughing fits, but it also irritated a runner's upper respiratory system, causing him to sneeze. The sneezing runner reminds us that fever can be associated with upper respiratory infections, like viral infections, as seen with the common cold. Next, let's see who else is participating in this chaos. Another vandal has come to join the party and is throwing shot put balls at the runners. Looking closely at this flying ball, you'll notice that it's flaming and shaped like a prostate. Anyways, this should make you think of prostatitis, and this can cause obstructive urinary symptoms like frequency, urgency, dysuria, nocturia, hesitancy, weak stream, and incomplete evacuation of urine. In acute prostatitis, the prostate will be tender and boggy on the rectal exam, with suprapubic tenderness due to the retention of urine in the bladder. The flying shot put was aimed at a runner and got him distracted. Now he tripped and fell in a puddle of mud. The mud covered his skin to remind us of skin infections, which can also cause fever. These infections can be caused by a wide variety of microorganisms that can be bacterial like cellulitis, viral like herpes infections, fungal like athlete's foot, and many more. Skin infections can be mild, self-limiting like pityriasis rosea lesions, and can be life-threatening like necrotizing fasciitis. Those flaming projectiles not only caused one of the runners to fall in the mud, but also set fire in these pipes the runner was holding, which scared him and made him wet his pants. The urine-soaked runner should remind you that urinary tract infection is another potential cause of fever, particularly upper UTIs like pyelonephritis depicted by the pipes on fire, pyelonephritis. Remember that this is a bacterial infection of the renal parenchyma, usually due to an ascending infection from the lower urinary tract. It's most commonly accompanied by flank pain, nausea, and vomiting. The Vandals brought more than just flaming projectiles. Sitting on a table are steaming red cherry pies, just waiting to be launched. Pie sounds like pyogenes, as in strep pyogenes, which is another cause of fever. In fact, fever is a component of the Centaur criteria used to direct diagnostic testing for strep throat. The red steaming pies should make you think of a red inflamed throat caused by a strep pyogenes infection. Now let's talk about the different causes of hyperthermia. Beside the steaming cherry pie is a steaming espresso maker waiting for some boiling vandalism. The steaming espresso maker, shaped like the thyroid gland, and the excess steam should make you think of thyroid storm, also known as thyrotoxic crisis, an acute, life-threatening hypermetabolic state induced by excessive release of thyroid hormone in patients with thyrotoxicosis. A thyroid storm presents with hyperthermia, tachycardia, and hypertension. GI abnormalities like abdominal pain and diarrhea, as well as neurological symptoms, altered mental status, and seizures can also be seen. The Vandals have another victim as they pelt the straggling runner in the head. This rock hitting his head should remind you that CNS lesions can also cause hyperthermia by altering the hypothalamic pathways associated with body temperature regulation. But who's responsible for this awful incident? In the back, we can see the guy who threw the rock. He hit the runner's head, which was especially violent. If we look closely, it's easy to see how he could do such a thing. He's been snorting cocaine, as evidenced by the white powder filling his vial necklace and under his nose. Cocaine is a potent sympathomimetic that causes many effects, including violent behavior and hyperthermia. Coming around the curve, one of the runners looks as though he exerted himself too much. He's crawling to the finish line and sticking his tongue out as if he's very thirsty, but he won't give up until he reaches the end. This overexerted, hot, thirsty crawling athlete should therefore make you think of exertional heat stroke, which can also present with hyperthermia. Don't confuse exertional heat stroke with classic non-exertional heat stroke, which affects more fragile populations such as the elderly and chronically ill. Both types, though presenting in different patient populations, are associated with negative outcomes if not properly treated. Looking away from the chaos, we see two sweet girls cheering on their father. As they watch, they share tunes to pass the time. Anyway, sharing tunes sounds like serotonin, and with all these musical tunes, we should be thinking of serotonin syndrome, another cause of hyperthermia. Serotonin syndrome is precipitated by the usage of serotonergic drugs, such as SSRIs, SNRIs, and monoamine oxidase inhibitors. This can present with symptoms like tachycardia, hypertension, hyperreflexia, myoclonus, and hyperthermia. If we take a closer look at the girls, we can see that one of them is carrying a Maleficent doll to keep herself busy. Maleficent sounds like malignant and should make you think of malignant hyperthermia as well as neuroleptic malignant syndrome, which are other causes of hyperthermia. Malignant hyperthermia is associated with depolarizing neuromuscular agents used for anesthesia, while neuroleptic malignant syndrome is associated with antipsychotic medications used for conditions like schizophrenia. And with that, we've covered everything you need to know about the differential diagnosis of fever.